Combined, non-Hodgkin lymphoma and Hodgkin lymphoma represent the seventh most common malignancy in the United States, and therefore these tumors are frequently encountered by hematology oncology practices. Although lymphomas are reported in the statistical literature as a single disease, the most recent WHO classification lists 80 established and provisional lymphoma entities. Thus, lymphoma entities are more complex than the statistics would suggest. From the pathology perspective, lymphomas are some of the most difficult diseases to recognize because they are morphologically complicated and because they have features that overlap between reactive lymphoid hyperplasias on the one hand and other non-hematologic malignancies on the other. In addition, the criteria for lymphoma diagnosis rely not only on the morphologic appearance of the tumor under the microscope, but also on immunophenotyping modalities, such as flow cytometry or immunohistochemistry. And in some instances, genetic analysis is necessary in order to correctly diagnose lymphomas. Therefore, unless the reviewing pathologist has subspecialty expertise in lymphoma diagnosis and has access to high-quality ancillary tests to assess tissue specimens, diagnostic mistakes that result in incorrect, ineffective, and overly toxic therapies are easily made. When patients whose lymphoma diagnoses were made at other institutions come to Mayo Clinic to be evaluated by our hematologists, it is our practice to review their pathology materials to confirm the diagnosis of lymphoma and to confirm its classification. In a retrospective review of that experience, we found that in 16% of cases, our subspecialty hematopathology review resulted in a revised diagnosis that altered the treatment recommendation of our hematologists. This review highlights the need for in-depth hematopathology expertise and experience with lymphoma pathology if these diseases are to be diagnosed and classified correctly. Mayo Clinic has a highly experienced hematopathology team. 9 members whose primary practice area is lymphoma diagnosis are included in a total division of 17 members. We have a combined experience of 114 years of lymphoma pathology practice, and we diagnose over 3,000 lymphoma cases per year. We are academically productive. Our group has contributed over 500 lymphoma-related articles to the peer-reviewed medical literature. We actively participate in all of the relevant hematopathology specialty societies, submitting abstracts and presenting continuing education courses on an ongoing basis. 4 members of our staff have authored chapters in the most recent WHO classification of tumors of hematopoietic and lymphoid tissues. And we also participate in the Mayo University of Iowa Lymphoma Specialized Program of Research Excellence, or SPORE program, that has been continuously funded by the NCI here at Mayo since 2002. In addition, we are connected with clinical laboratories here at Mayo that provide the highest quality ancillary studies to support the hematopathology practice. They are directed by staff hematopathologists who not only have in-depth knowledge about the technical aspects of the tests that we perform, but also who understand the diseases to which these tests are directed. The laboratories include comprehensive immunohistochemistry, flow cytometry, cytogenetics, fluorescence in situ hybridization, molecular hematology, and mass spectrometry. Finally, our group understands the clinical relevance of our lymphoma diagnoses because our work is closely tied into the Mayo Clinic hematology practice. We communicate with our clinicians on an ongoing and daily basis regarding the lymphoma patients. Our hematopathology group would like to provide consultative help to you with your lymphoma pathology difficult diagnostic problem cases. We provide excellent service to our clients who send hematopathology consults to us. We have a conservative approach in the use of ancillary studies so that in the long run we save costs with our diagnostic analyses. This approach is validated through an ongoing review of our practice and the development of practice algorithms to ensure that only necessary tests are performed in the evaluation of our cases. We have quick turnaround times in most instances, even when evaluated here by immunohistochemistry or FISH. Our turnaround time is usually around 2 working days. All of the ancillary studies that we perform in the context of the consults are integrated into the final report, and we communicate by phone to referring pathologists, hematologists, and oncologists to discuss the pathology findings and make sure that they fit correctly within the clinical context.